Watching Christopher Fergoso walk down the hall, you'd never know that less than a year ago he couldn't do this without hunching over. He suffered from a severe case of scoliosis, something he has battled for the past 5 years. At first, it was just some minor back pain that sent him to the doctor. The x-rays showed a quite different story.
It was a pretty big curve. It was about a 35 to 40 degree angle curve. I never expected that.
The diagnosis of scoliosis at 17 years old came as quite a surprise to Chris.
I was pretty much in denial. I was like, no way, Then the back pain just kept going on, and I was like, okay, well, the doctors know what they're talking about. They're trained professionals, so this is what I have.
Scoliosis is a curvature of the spine. It's somewhat common. About 1 to 4% of the population has it. However, only 1 in 1,000 needs surgery to correct it. His next step was a visit to Dr. Fred Sweet at Rockford Spine Center.
Most patients with scoliosis don't have limitations. They don't have pain. And that's why consideration of surgery is really kind of a difficult road to navigate.
In fact, Dr. Sweet recommended that Chris not move forward with surgery at that time. As his pain continued to worsen, Chris sought a second opinion out of state. That doctor recommended surgery right away. 7 months after his initial diagnosis, Chris was on the operating table with the second doctor.
He underwent a very extensive procedure that fused most of his spine. That was the thing that we were trying to avoid.
Unfortunately, Chris suffered from some complications following the surgery and spent several months in the hospital.
And when his spine fused in the lower half, it ended up with him being pitched very forward and off to one side. So now he went from being relatively pain-free and without limitations to being very debilitated, very crooked, and very painful.
Chris spent the next several years learning how to deal with the pain. He admits there were good days and bad days. A year and a half ago, he fell on some ice, and the pain was too much for him to bear. This time around, he decided to go back to Dr. Sweet.
We have a very large population of patients that have had surgery elsewhere that just hasn't worked out well for them, and we have to go to really dramatic surgical efforts to improve their quality of life.
Chris needed another round of surgeries to correct the first surgery. He had some broken rods from the stress of the angle of his spine. In May of 2011, Chris underwent a 6-hour surgery to remove all of the old instrumentation and prepare him for the next step. It was not going to be an easy procedure.
So we cut the spine in half here and here to gain all the correction we needed to bring his trunk back over his pelvis.
It took another 6 hours of surgery, but Dr. Sweet was able to straighten out Chris's spine. Chris noticed a change right away.
Oh yeah, I feel a lot better. It's kind of like one of those instances when you don't feel like something's wrong, but then when it's corrected, you're like, whoa, there is a huge difference.
And his road to recovery has been a lot smoother.
This time went a lot faster. I mean, within a week, I was feeling like myself again.
Chris's pain has gone from a 9 or 10 on a daily basis to a 2 or 3. His 5-year journey has been a tough one at times, but he is moving on, happy, healthy, and heading back to work soon.
Oh, I think he looks fabulous. He's 4.5 inches taller. His head and trunk are centered over his pelvis. When you see him walking out in public, you would never have any idea he ever had a spine problem.